All right, let's get back to the big story we're tracking this evening, which is the addition of Moderna to our range of vaccines which will be available in India. Now, the introduction of Moderna or Pfizer or Johnson & Johnson, these three foreign-made vaccines, has been hanging fire for a while. The only foreign-made vaccine which has been allowed so far actually has been the Sputnik V, whose entry into the Indian market has been slower than anticipated, and those supplies are still trickling in. But today, Moderna has effectively got the nod, that is, it's got its emergency use authorization, and Cipla has been giving permissions to import this vaccine by the drug controller. So it's supposed to have an efficacy of over 90%. New studies show that it does work against the Delta variant, and it will come in ready to inject shots that require storage at -20 degrees Celsius for 7 months. Let's listen in to what the Niti Aayog's Dr. V.K. Paul said at the Health Ministry briefing about Moderna today.
You know, today it's important for us to say that a regulatory step has been taken, clarified, cleared, and this opens pathways for import in technically any of the modalities that you are referring to. Let's wait and see how this opportunity is to be used and will be used for importing vaccines into our country. Thank you. No, there will be no need for bridging study. That has been already clarified. This modification in our regulation happened several weeks ago. So no, उनको कोई ब्रिजिंग ट्रायल नहीं करना होगा. पहली 100 डोजेस को जिनको मिलेगी उनको वॉच करेंगे. बिल्कुल क्लियर पाथ हो गया है इस वैक्सीन को देश में आने के लिए. इसका 7 मंथ्स तक जो स्टोरेज है वो -25 से -15 तक होता है. तो आप ये 20 डिग्रीज ले लीजिए. So medium term storage is at -20, the range being -25 to -15. अगर एक अनओपन्ड वैक्सीन की वायल है उसको 2 से 8 डिग्री तक मतलब नॉर्मल कोल्ड चेन में अगर रखें तो ये हम 30 दिन तक ऐसे रख सकते हैं.
All right, Dr. Ramanan Laxminarayan, Director at CDDEP, joining us on the show for more on this. Dr. Ramanan, great to have you back on the show. Let's first get your take about the addition of Moderna. Is it a little late? It's the first mRNA vaccine. Will we have enough supplies to make a difference is the key question.
You know, that's a really good question, Tamanna, because that information has not yet been released. Now, it is the US has made Moderna available through COVAX to a number of countries, and certainly India would be one of the countries that would be eligible there as well. And the quantity was announced as about 100 million doses, and it's unclear if this would be just part of that. Certainly, I wish that this had happened, many months ago, probably because not much has changed in terms of the conditionalities to get this vaccine in, in that period of time. Essentially, India is accepting the same conditions, which is that no bridging study would be required. There'll be central procurement. And the one issue that is still a little opaque is really of the liability waiver, which the US companies have been requesting, because they are getting that liability waiver in the US and in other countries as well. And India has thus far refused to give any vaccine manufacturer a liability waiver. But I suspect that if the EUA is being given, that in effect that liability waiver is being granted, because otherwise it'll be difficult to get that vaccine into the country.
That's the interesting point, and you're right, there's no clarity on that, because if a liability waiver has been extended to Moderna, and today the message was that Pfizer's coming in quickly as well, so will it be extended to the others, and what does that effectively mean? That's the big question. But Dr. Ramanan, from a practical point of view, right now we know ready-to-use shots are going to be imported by Cipla. We don't know where it's going to be priced, but we can assume that it may be to a large extent in the private market. My question is, how big is that market right now? Because all those who could afford or have access to vaccines have gone ahead and gotten vaccinated in large numbers. Will there be a large market or appetite for Moderna? Number one. And number two, will it be used perhaps in mixing and matching, which is something being experimented around the world?
Again, a good question. Here is what I hope will not happen. I hope that this vaccine will not be primarily used by people who have already received the other Indian vaccines as a way of sort of, bumping up to the higher protection that the mRNA vaccines offer. In fact, there was a study that came out yesterday which showed that there were indications that the mRNA vaccines would have long-term protection, something which has not yet been shown in the non-mRNA vaccines. So it is entirely possible that at least some of the supply may go to people who've already had the vaccine and then they're just looking for an additional protection. I think the devil is in the details. How do we determine that this vaccine is actually to protect people who have had no vaccination so far? And personally, I would look to see if these mRNA vaccines can be targeted at the highest risk age rather than offering this to 20-year-olds who simply do not need, this quality of a vaccine, and certainly.
Yeah, that sort of excitement about a foreign vaccine and an mRNA vaccine is also fueled in part, Dr. Ramanan, by studies like the one which came out today, saying that Pfizer and Moderna may give immunity for much longer than the other vaccines out there against COVID-19. Do you think that's why they may be in high demand? And is there any sort of trust in these claims so far?
I think those claims are actually backed up by evidence based on, the kind of they're looking for the ability of the body to mount an immune response and to regenerate it every 15 days or 20 days. And that's what the most recent studies have shown. Similar studies have not been conducted for the AstraZeneca or the Bharat Biotech vaccine. So we do not know the duration of protection for the Indian-made vaccines. But it is not just the duration of protection, it is also the efficacy of these vaccines. Moderna's efficacy is 94%. The three vaccines that we already licensed in India, none of them approaches 94%. And there's a big difference between having a 75% efficacy vaccine and a 94% efficacy vaccine. And you couple that with the fact that this may end up costing money. My concern is that this may end up in the arms of people who already have had the other vaccines, who are just looking for additional protection, so to speak, because the evidence is also mounting that far from being dangerous, combining vaccines, which is a non-mRNA and an mRNA vaccine, could actually be providing greater protection than just having one of those vaccines. So all of this coming together to perhaps raise some questions on who exactly will get these vaccines.
That Moderna jab may make it easier to travel in more parts of the world. That could be an added advantage to those who end up getting these vaccines in their arms. Thank you so much, Dr. Ramanan, as always, for joining us with perspective on this very big development today.